Hi, my name is Devin, and I'm a hospital medic. Here's my badge. Tucson Medical Center, second busiest emergency department in the state. And I'm also adjunct faculty at the Public Safety and Emergency Services Institute. Here's my badge. I've been a medic for about 7 years. Started teaching a little while ago. And I'm going to show you how to train your nurses and your paramedics using virtual reality or a web browser or both. Ready? Okay, let's get started with the web-based version of the platform. As you can see, I have access and am logged in to VRpatients. And just so you know, I am using Wi-Fi, Google Chrome, and a Windows computer. That's it. Right now we are in the Cases tab, or basically your scenarios, and it comes preloaded with a bunch of patients and scenarios so you can start training your nursing student or your paramedic student today, virtually, right now. So let's get started. Let's try Cheryl. She's in a clinic, and if we decide to transport her, she'll be in an emergency department, and she's got high blood sugar. All I have to do is click this button here. Run. Okay, you're looking at the student view. I get this dispatch report that this person is sick and her blood sugar is elevated. That's all I know. Let's be transported virtually to a clinic now. And here we go. I'm in a clinic setting. I can see I have a patient. Let's do some focus here. As you can see right here, she's got a laceration on her cheek, but she was complaining of high blood sugar. And I don't really know anything else about this patient, except for her bed rail is down. That's a big no-no. So let's immediately raise the bed rail. And I need to see what's going on with her. So I'm going to put her on the monitor. I want to see her oxygen, her end tidal, heart rate, blood pressure, and of course, her sugar. And immediately I have some information to work with. She has high blood sugar. Maybe she fell and she cut her cheek on the edge of a table or something like that. Now we can do some quick assessments. I can put on my PPE and select what I want to wear, which could be critical fail criteria in your assessment. And I want to assess this patient. So first of all, let's just remove her upper clothes. Now we're all professionals here. So you're about to see some skin. And here we go. Uh-oh, it looks like she's got some sort of injury or trauma, maybe decubitus ulcer, wound, burn. We don't know. She's got something going on right here on her belly or her abdomen. Now, I happen to know that I added some moulage to this avatar quite quickly to kind of throw off the student, which you can do. We're here to treat the sugar, 386, but the student doesn't know that. All the student knows is that they have a patient here. And now that we've taken off their clothes, we can see that they have some injuries. That is extremely easy to do, and I'll show you how to do it on the back end. So let's just do some assessments. Let's do a stethoscope and listen to their lungs. All right, I can hear her lungs here and here. Get some heart tones. How about the back? Listen to the back of her chest. What's her posture like? I can see her posture here. Exit the stethoscope. How about a pen light? Let's check her eyes. We have a nice close-up of her eyes with really awesome graphics. Look at the laceration here. You can actually really see behind the face mask. I take the pen light, encroach on her pupils, and they dilate. And did you see the left one also reacted slightly delayed? Very realistic. But I need to speak to the patient. So let's go to dialogue, and we're going to ask questions. So I go through, and as I select these questions as a student, I'm getting points for them. They're ticking off the box. I'm getting my sample OPQRST and making sure I'm getting a good history. And here at my computer, I can take notes on the history and the patient history. Then when I go back into assess, I can decide what assessments do I want to do for this patient. I want to do a spinal assessment. And if I had any issues with the spinal assessment, here it would flag it for me. And then I can start treating this patient and literally give a bunch of medications. We can decide, what do we want to give this patient? Is she nauseous? Does she need D10, 25, 50? And am I going to get points, the correct points for that? Maybe I want to put in an IV. So we're going to select the site. We're going to do anal-cubical on her left side and 500 milliliters administer. And sure enough, right here, you can see it right here. She's got an IV line that has gone into her arm. And there's the IV. See, it is on the back of the bed. The IV is here, and it is actually in her arm right here. So as you can see, very quickly, we're able to treat this patient and get her on her way to definitive care. Now, the back end. So very quickly, you're able to see what a patient care scenario looks like from the student's perspective using just a computer and an internet connection. Now, Let's say that you're an instructor and you want to make changes to the case. Well, how hard is that? You click the blue button down here, edit. And here we go. I've got a whole host of options, complete control. I do not need to call an engineer and ask them to rebuild a case scenario for me and wait for that to be delivered so my students can start treating a different type of patient. I can take full control of this tool as the subject matter expert and sim specialist at my location and make changes accordingly so this patient is different from my student tomorrow and they think it's the same one. I can change the scenario, switch out her room. Let's put her in the emergency room to start with this time. I can change if I want it to be Patricia now. We're going to go to the dispatch report and I can rewrite this information. I can change the learning objectives or adjust the problem. I could say burn to the abdomen and laceration to the face. Patient conditions. Let's say I want to change that laceration or I want to change something else about it. She's got something else going on. Let's go to her upper left leg and I am going to put an abrasion on her leg, a large abrasion on her leg. Done. That's it. The abrasion is on her upper left leg. That took 2 seconds. Let's try on her right arm. I'm going to put a bruise. Let's do a contusion on her right arm. And there it is. It's healing or fresh. How about fresh? She just fell. Done. So now she's got a burn on her leg and a contusion to her arm. We'll take a look at that in a second. She was starting on her side. This time I'm going to start her seated forward. And she has some starting vitals here, a heart rate, a systolic blood pressure, and these are her starting vital signs, which I can completely change. I can also upload my own chest sounds. I can change stuff about her eyes with the pen light and her pulse. Now, before I go in and show you those changes, I'm going to run through these features on the left-hand side really fast, and then I'm going to show you the virtual reality view. Dialogue. I can choose which questions I want to be added into the system. So on the left-hand side, these are the questions that are at the beginning, and these ones have not been added yet, or I can take them away, move them around, and rewrite them. IV, I can choose what the student wants to have access to, and it will appear in the system as an option for them. I can highlight all of these if I want to and see if they'll accidentally give the patient an external jugular IV. Medications. All of these medications simply need to be turned on. When you saw before, it looked like only the right answers were kind of in there for the medication list. Well, let's put them all in. Let's put half of them in. Let's put 50 meds in, 5 meds in. Let's see if they accidentally give nitro when they should have given Narcan because they're a new student and they just picked a medication that started with an N and they couldn't remember what it was called. Oxygen. Do we want to have oxygen options available to them? Just turn it on. Interventions. Well, we want to do bleeding control. We want to do some burn care. We can do a dry sterile gauze, and all of these things will become available for them when I just simply turn on the intervention. All the procedures that I want them to be able to do, vagal maneuvers, nasal swabs, double gloves, compressions. I can select what monitor. Let's say our students are used to seeing the Philip Tempest Pro in the hospital setting. Media. Oh, I have a 12 lead. I can swap this 12 lead out. Here's the 12 lead that will appear in the system when the student does a 12 lead. But maybe I want this to show an NSTEMI or something else to throw the student off. I can see grading, which means critical fail criteria. I can set things in here that are critical actions. You have to do this. These are all critical actions here. If you do not put an IV in, you are in trouble. If you put a left external jugular, you have to avoid this. This is a critical failure. This is called case logic. This allows us to go at a granular level and make changes to the physiologic responses that the patient might have to different types of medication administration. Now, I'm not going to go into depth on this because VRpatients provides one-on-one support training to make sure that your subject matter experts know how to do this successfully. We all know that patient care, it's not simple. Patients are complex, and so is the physiologic response that they have to medications. You don't have to use this authoring tool to make changes to your patients. But if you choose to, you can change at a granular level whatever you want the patient to do, and the student has to respond and save their life, or the patient will not end up with a positive outcome. This system is the only virtual training platform that I have seen that allows you to have full control over the physiologic response without needing some sort of engineer to redesign and recode and rebuild the game for you. You have complete control. Let's take a quick look at the changes I made to Patricia. Okay, here we are. This is our new Patricia, and it took me all of what? 3 minutes to make these changes. She's sitting up, and there is the bruise, abrasion to her arm. What about on her leg? We're going to remove her lower clothes, and there it is. Quickly adding moulage to your patient so you can make your scenarios more complex for your students and potentially throw them off. We also changed out the monitor. Let's see what it looks like. And there you are. There's the Tempest One monitor with our patient in the emergency department setting and new moulage added in a matter of minutes. Before I show you the virtual reality version where you actually need a headset and you walk up to the patient, you should know, as an instructor, this view is always the same, accessible via your computer. So when you pop in here, you can make changes and edit these scenarios, and they show up edited in the virtual reality version. It's automatic. You can see the assignments that you have pending or in progress or complete and your list of students. You can look at your organization management, see everyone who is in your organization, that would be your students. And also, super helpful, you have notifications here. Now these notifications are video tutorials from the software company, new links for videos on how to do stuff, tips and tricks, and hot fixes coming in when there's something that's being updated about the system so you're aware. Let's take a look at the virtual reality version. Okay, and this is the virtual reality view of VRpatients. Now we've loaded in, and as you can see, this is kind of the waiting room. It's a fire station, and I've got my case scenarios in front of me, my list of patients, and we can load right in. So let's do that. Before I do, I just want to say I'm using a wired headset right now, and you could easily use a wireless headset for this. This is an Oculus Quest 2, $300. Go pick one up at Target today, and your students are training in virtual reality tomorrow. All right. That down. Now, last time we saw Cheryl in a clinic. Let's do something a little bit different, and let's do Joshua on a street corner. And here we go. We have some information. A man at the bus stop said his sugar was low when he passed out. So I just want to point out that immediately when I turn my head, I'm in the environment, I can see my controllers, and I'm here with the patient. The difference is that in the web version of the platform, you're just staring at the screen and you see the patient in front of you. It's still very immersive, but it's nothing like virtual reality where I get close and I can literally bend down and look at the patient's skin. I can look inside their mouth. I can look to see, are they breathing? And as a student, you have to remember, I don't know what's wrong with this person. I need to figure it out. So first thing, let's remove the upper and lower clothes to make sure we don't have any trauma. No trauma. It looks like we have a monitor here. I'm going to pick it up, put it on the end of the bed. We're going to put them on the monitor, just like we did before. Now I can see they're on a 2 lead and an end-tidal CO2 capture, and there's all of my information on the monitor. We can see the problem. Their glucose is low. Let's go into assessments. Stethoscope. I pull out the stethoscope. I see the patient open his eyes for me so I can assess his pupils. And I can listen to their lungs. I can turn the patient over. Now I want to point out something. I can assess this patient head to toe. I don't actually have to walk around, I can teleport around. The patient is lying in the recovery position. They're going to lay back down. Let's assess their pupils. The pen light. Come over. Come down at the patient. I was very realistic. Pull out my pen light. As you can see, pupils dilate. Pupils dilate. Look at, I can see the eyelashes on the patient. This is the difference between treating the patient in virtual reality and treating the patient on the computer. Both immersive, Both very helpful, but this one makes me feel like I'm there. I can hear cars, I can hear the birds. Here's a cool one. When I go to palpate pulse, come over here, put my hand on the radial, and what you can't feel right now, which is so cool, is that my controller is vibrating at 73 beats per minute. Let's try the jugular. I should be able to do this in virtual reality. I should be able to just, wherever I feel a pulse, and look at that. That is so neat. How about a pedal pulse? Oh, wow. I didn't expect that, to be honest with you. I can still give medications, put them on oxygen, whatever I need to do. The difference is that I'm actually here, actually treating the patient. They're going to respond to the things that I do, and I don't know what's going on except for a simple dispatch report. And I've got to get to the other end of patient care with my knowledge as a competent nurse or paramedic student. And if I fail, good. Fail fast and fail often. That's what school is for. So you can make mistakes in a virtual clinic or field scenario, and you make fewer mistakes in real life. Increase your student success metrics. Don't wait. Start virtual reality tomorrow. You only need $300. Well, look at that. I failed.